Dr. Ray, can you just explain a little bit your area of expertise and how you got into that?
Sure. I consider my area of expertise now to be in what you might call metabolic and nutritional medicine. I'm traditionally trained as a board certified OBGYN, spent about 5 years in practice, and kind of realized that I didn't have the types of patient outcomes that I really wanted. I didn't really seem to be able to get people well. Doing surgeries on them helped some people. Medications help to a degree, but it seemed like people had some core issues that revolved around lifestyle, their philosophy on life, their concepts about health and well-being, or lack thereof, and I really wanted something more. That sort of coincided with my wife developing some kind of mysterious, complex problems that multiple drugs and multiple traditional doctors did not seem to be able to help us get anywhere. And at one point, my 32-year-old wife was on crutches, deeply fatigued. And, when you've got 4 children, you're a solo practice OBGYN, and your wife is in trouble, it's time to make some changes. So I sort of call myself a reformed OBGYN.
I think what you talked about is common. A lot of people don't get what they want when they go to the doctor. Why is that so common, do you think, and what did you do, or what do you do now that's a little bit different?
When I go to the drinking fountain, I'm not upset because espresso doesn't come out. So you can only get from someone what they have to get you, to give you. What I don't think Americans really understand how doctors are trained. And without sounding jaded or judgmental, frankly, when I look at my training, I was trained to do surgery and prescribe drugs. But that's not the solution to today's healthcare, really what should be called sick care problems. Now what I do is I attempt to understand the patient as a whole. I'm the result of all of my choices that I made between whenever I started making them and right now. The, the painful and beautiful fact of that is that at least I can make new choices and have new ideas. And that's really what I found myself doing with people. I'm sharing new ideas with them. I'm helping them understand that they can adopt some new philosophies. They can consider some new options. They can try some new things. And instead of looking for the new vitamin or hormone fix to their complex problem, we begin to unwind that tangled web that they've created. That's a process. It takes time. And a lot of people don't stick with it because really I think our philosophy as Americans is, I want it now, and it should be pretty cheap. But you know what? I really believe that our well-being is maybe our only fundamental human right, and it's worthy of pursuit.